There are three main kinds of tests we generally do on these analyzers: endpoint tests, rate or fixed time tests, and kinetic tests. We will discuss one test of each kind in this tutorial. We will take up the principle of each as we get there.
When an analyte is measured using a chemical reaction, there are two options for assessing concentration. Wait until the reaction is complete and all of the analyte is converted into the product. This is called endpoint reaction. Or measure the rate of change in the product found over time. This is called rate reaction.
Endpoint chemistry, a method employed for the estimation of analytes which would be completely consumed in the reaction. The endpoint for a particular analyte is normally achieved within 5 to 15 minutes at 37 degrees Celsius. This absorbance increases against the reagent blank absorbance over a period of time. This increase in absorbance continues till it reaches a stable value, marking the endpoint of the reaction. No further change in absorbance would occur if it is read a while later. The colored complex or non-colored complex thus formed at the end of reaction period is read for its absorbance and multiplied by a calibration factor to get the value of the analyte in that sample. This method is standardized to consume the amount of analyte equivalent to the linearity level mentioned for individual chemistries within the stipulated reaction time.
If the analyte value is beyond the linearity, then the graph will not be linear and the test is repeated. The dilution as per the protocol outlined. We will discuss this also again later. An example of the endpoint reaction is the measurement of glucose by glucose oxidase or peroxidase, GOD-POD method.
Glucose is oxidized into a red-colored compound. The intensity of the red-colored compound is proportional to the glucose concentration and is measured at 505 nanometers, which is 490 to 530 nanometers. Fixed time method or rate methods. The methodology of these tests are based on the principle of difference in absorbance between an initial value and final value during a specified time interval. The time interval is optimized in such a way to minimize the interferences from other analytes in the sera or sample with the test analytes. The assumption is that a constant amount of product is produced during the specified time period. Generally, these tests have a pre-incubation period of the sample with the reagent which can be programmed within the instrument or outside. It is during this period that any substance other than the test analyte present in the sample which could react and interfere with the reagent system is removed completely. The time interval is standardized and usually fixed to a minute or two to give accurate and precise results for the analyte being estimated. Fixed time chemistries could be of two types. A. Increasing type. This is fixed time chemistry progressing in positive direction. The final absorbance is greater than initial absorbance. Therefore, the difference between the final and initial absorbance, called as delta absorbance, is always positive.
Decreasing type. This is fixed time chemistry progressing in a negative direction. Here, the initial absorbance is greater than final absorbance. Therefore, the difference between the final and the initial absorbance, called as delta absorbance, is always negative. An example of the fixed time or rate reaction is the measurement of creatinine by Jaffe's method. Principle: creatinine reacts with alkaline picrate to produce a reddish color. This is also known as the Jaffe reaction. The colored complex is read at 5.5 nanometers.
Kinetic method. The principle of measurement is the difference in absorbance between 2 points over a period of specified time during the progress of the reaction.
The assumption is that a constant amount of product is produced in unit time during the time interval.
This is also rate chemistry, but the principle depends on the progressive reaction. Usually the reaction is very rapid and thus reaction time is short to avoid any danger of enzyme degradation. These tests are performed with a pre-incubation phase, usually done inside the equipment as programmed into it, during which any substances in the sample which might interfere with the test would have fully reacted with the reagent system. In kinetic test procedures, the difference in absorbance between 2 points taken during the linear stage of progression of the test is taken into consideration to yield the delta absorbance. This time interval is very short, usually ranging from 20 seconds to 1 minute or more. The delta absorbance obtained is multiplied by an appropriate factor for calculating the exact value of analyte. The delta absorbance that are consistent over a period of time are taken for calculation. These tests are standardized to give a linear delta absorbance over a period of time and up to the specified linearity mentioned for each analyte. Kinetic chemistries could be classified as A. Increasing type. In this type, the reaction proceeds in positive direction, wherein the initial absorbance is always lower than the latter absorbance.
The difference between a latter point and an earlier point is always positive.
B. Decreasing type. This type of chemistry is also called as a negative direction type.
Initial absorbance is always higher than the latter absorbance. Difference between a latter point and an earlier point is always negative. An example of the kinetic reaction is the measurement of SGOT by IFCC without P5P method. Principle in this case of ALT. This reaction is based on IFCC recommendations without pyridoxal phosphate. The series of reactions involved in the assay system results in reduction of NAD to NADH, which is measured by change in absorbance at 340 nanometers.